I am just going through the list and giving folks access to record, and we will start in just a moment. KGW, do you mind double checking that your camera is off? I believe I have given everyone access to recording who needs it. If I missed you, just give me a nudge in the chat. But as far as I can tell, everyone has access. We are admitting, and it looks like we've admitted everyone. So now I'm going to turn it over to Dr. Jennifer Vines and Dr. Ann Loeffler to talk about the situation in our pediatric hospitals. Thank you.
Thank you so much, Ryan and Julie Sullivan and Multnomah County Communications. Good afternoon, everybody. Thank you for being here on short notice. I'm Dr. Jennifer Vines. I use she, her pronouns. I'm the Multnomah County Health Officer, and I'm also the lead health officer for the Portland Metro 3-county region. I'm joined today by Deputy Health Officer Dr. Ann Loeffler, who's a pediatric infectious disease expert and continues to care for hospitalized children in addition to being a public health physician with Multnomah County. Again, I appreciate you all being here. If you don't know me, I've been the health officer through the entire pandemic, and today feels very similar to past moments where things have been particularly serious. So I want to talk about 3 different things today, and I want to make clear up front that I'm not here to speak for the hospitals, but I am going to make sure the public understands what is going on with our 2 flagship pediatric hospitals in the state, which are both located in Multnomah County, what it means that they have both turned to crisis care standards in the last 2 days. I'm going to talk about RSV and the other respiratory illnesses that are coming in quickly behind it as drivers. And then I'm going to acknowledge that we are, of course, the day before a holiday that involves a lot of gathering and eating and a lot of wonderful socializing, but want to offer some risk reduction advice for particularly young families and others who are high risk who may be listening. So first, I want to make sure everybody understands that, again, both of our 2 children's hospitals announced that they have transitioned to crisis care standards of care. That typically means that they're at capacity. They are caring for the number of patients that they are absolutely able to, and there's no way to transfer out the next patient. So in order to create more room, they're doing things like delaying procedures that can wait. And they're also getting creative with staffing, which is understood to mean that staff are asked to care for more than the usual number of patients that they might be asked to care for. And this is really a result of full pediatric intensive care units, which are specialty services that fortunately most children don't need, but right now many do. I have to believe that we all care about children. I have to believe that we care about the well-being of all of our healthcare workers. And I want people to know to keep your kids close this holiday. So we're going to be offering some risk reduction advice for respiratory diseases, but it's really important to know that anyone who relies on these types of intensive care for children is potentially at risk of running out of beds or having to take more drastic measures to accommodate patients. Again, not speaking for the hospitals, but wanting to be really crystal clear about what's happening in our community and statewide. So the next piece is RSV, respiratory syncytial virus. I know many of you have covered this as a topic. It's a very common virus that Dr. Loeffler can speak to in more detail, but we've seen a very steep climb of this virus over the course of the last month. It's driving anywhere from 1/4 to 3/4 of hospitalizations, in particular among infants and young children. We see influenza coming in at a steep climb close behind it, which also affects young children and the elderly. And then finally, we've seen our first small uptick in COVID that had not been part of the OHSU forecast. And so COVID may be on the heels in addition. So we're really trying to reach families of young children. In addition to extensive outreach that Multnomah County has directly done to these groups, we really want to make sure that anyone caring for an infant or a small child knows what steps to take to lower their chances of severe RSV. And again, I'll let Dr. Loeffler talk about that. Finally, we're heading into a holiday tomorrow. It is a gathering holiday, it is an eating holiday, it is a wonderful chance for people to be with loved ones and strengthen social connections and take time off work. And I fully support that and the health benefits that come with that. I know it may be late to change plans, but again, we all know the prevention steps for limiting respiratory illness. So that's things like streamlining the size of your gathering. It's staying home if you're sick. And staying away from others. If you have to be around others, then making sure your hands are clean, wearing a mask, using physical distancing, and definitely refraining from close contact, hugging, kissing of babies, young children, and others who may be at higher risk. So I wanted to just offer up that brief framework. I'm going to turn it over now to Dr. Loeffler for some additional details about RSV, respiratory viruses, and other steps families can take.
Thank you, Dr. Vines, and thanks to everyone for everything you do to keep our community safe. As Dr. Vines introduced the topic, respiratory syncytial virus is a very common virus. We think of it typically as affecting essentially every baby, infant, toddler in the first 2 years of life. And as we all know, things have been crazy the last few years. And so the last 2 years have been very atypical RSV seasons. And many young children did not get RSV in the last 2 years of their lives, and which is also the first 2 years of many children's lives, nor did their mothers get RSV in the last 2 years. So we are not exactly sure why this current surge is so dramatic and so abnormal, but many of us suspect that the young children who would normally have gotten RSV maybe every winter haven't gotten it the last couple of years, and now more kind of toddler, preschool, school age kids are getting it, and they're bringing it home to the little babies. The little babies have always been at the highest risk, in part because it might be the first season that they're picking up RSV, and because their little airways are so tiny that all that mucus that collects from the infection of those little air tubes is clogging everything up. It's very much a mechanical problem. So we think that those are the reasons why there are more kids getting RSV right now, all of a sudden, in a peak that hasn't been seen in the, dare I say, 30 years that I've been a pediatrician. So unfortunately, that means we all have to do our part. And regarding the Thanksgiving gatherings, I would just ask every single family throughout the United States and any other place where we're seeing surge in RSV and at risk of not having capacity to hospitalize any more children. Families need to look at what's going on in their individual family and consider people who would be at risk. So young children less than 6 months of age are at the highest risk. But right now, about a third of the hospitalizations are in the 6 month to 3 year age. And again, corresponding to the possibility that these slightly older infants and toddlers haven't had RSV the last couple of years. And then we also know that elderly and people with immunocompromising conditions also can get severe RSV. So if you are in a situation that in your household you have vulnerable family members, you may consider not going to that event. And one thing I would say is that it's hard to have that conversation, but consider the possibility of calling that host and saying, you know what, I think we have to delay this. We may need to schedule our Thanksgiving for February. And if you're a host and you're getting that phone call, I would just suggest that you be very gracious and you say, we completely understand the health of our family is the most important thing. And I will make you a care package. So-and-so in your family can drive up and you take home a dinner for all of you. We'll include some disinfectant wipes and you don't even think about the fact that we'll be sad to not have you there. So that would be the first advice I would give. Consider not having everyone who's high risk come to that bigger family gathering. And then, my other advice is the same things that we've been talking about with COVID, except that now we know that COVID and flu are both transmitted in air, for kind of a 6 feet distance. But we've always known for 50 years that RSV is transmitted more on surfaces. So when you cough or you wipe your nose and then you touch the tabletop and the next person touches the tabletop and then touches their eye or nose, that's how the virus is transmitted. You have to be really close to someone in mid cough to pick it up kind of through the air with those droplets. So it changes how we advise people to keep safe. People should be washing their hands a ton. They should be thinking about those surfaces where the virus might be planted by someone who, didn't think about it and just had those secretions on their hands, because the virus can live for hours on those hard surfaces. So hand washing, keeping your hands away from your face unless they have just been cleaned or sanitized, and working on those high touch surfaces. Masks are very helpful. They're very helpful, especially if you're shedding the virus. And unlike these other viruses that we've been dealing with, people do get symptomatic when they have RSV, but they can shed it for about a day before their symptoms start. So masking helps if it controls spreading the virus, and it helps in terms of not picking up the virus if it reminds you to wash your hands and not touch your face. So, that kind of gives a framework for thinking about, what you can do to keep your family members safe, but still gather and still share the love that we've all been missing in lack of contact during the last couple of years. I'm glad to take other questions, or Dr. Vines, if you feel like there's something that I didn't cover, I'm glad to talk about it.
I know you meant to include advice to get vaccinated for influenza and for COVID. So influenza vaccine recommended, safe for everyone 6 months and over. COVID, similar, in particular the COVID booster, if you are due and you are feeling well and out and about this weekend, put getting those vaccines on your list if you haven't already. I think maybe with
right.
that.
And just a reminder, if you're someone who feels like, I'm healthy, I'm not at big risk, just think about this. By you're getting the vaccines, you are cocooning and protecting those babies who are less than 6 months of age who are not yet eligible for the flu or the COVID shots. And I'll just add one more, and that's the whooping cough shot, another infection that's very dangerous in young babies. So yeah, great idea. Thank you.
I think, yeah, great. Communications is inviting questions. I think we're ready. I'm sure there's more to say, but I think we got our key messages across for this particular moment. And again, thank y'all for being here. Happy to do some Q&A.
We are going to start with Christina. So Christina, could you please unmute yourself and ask away?
Yeah, thank you, Christina with K2 News. I know you mentioned you're not speaking for those hospitals, but as the county health authority in the county where the state's 2 children's hospitals are, can you speak to the fact that Oregon's OHA's toolkit for crisis of care system talks about transparency? Those hospitals have not come out and talked about what their plans are for this and have not met those transparency requirements as a result.
Yeah, thanks, Christina. I really can't speak to that. Understanding is really between the state and individual hospitals. I know that both hospitals have come out publicly that they are in crisis care, but I don't have any other details.
Do you know, for example, sorry, a quick follow-up question, if they will need to lay out at what point, hopefully they don't get to this, but if they do have to switch to where they're triaging for the essential care, they have to notify when that happens, or is it just announcing the crisis and that's the only requirement?
So I do know that neither hospital is at the point of triaging. It would really be a question for OHA, your specific question about what level of notification would have to happen if they do reach that point. And again, we're really hoping by getting this information out that we don't get there, but thanks for the question.
Thank you.
Thank you, Christina. Next question is for OPB.
Hi, my name is Lillian Mongeau, Hughes with OPB. Thank you for taking my question. Given the shortage in pediatric beds, how would you recommend parents evaluate whether their child is in need of urgent enough care to go to the ER?
Interestingly, you know, what we advise to families is really the same regardless of the pediatric bed status, because you know, the families are hopefully getting advice now from their clinics and their providers, and to some extent from the media, how they can keep from needing to go to the emergency room. And the key things there are keeping the kiddos' nose clean, using some salt water and some sort of nasal aspirator, using some Tylenol if by bringing a fever down, it makes the kiddos feel well enough that they can drink enough to stay hydrated. If kids get dehydrated, their secretions get thicker and they're very hard to clear. And of course, dehydration is generally unhealthy. So what we're trying to do is give families through every route possible the information to keep the kids in as healthy a condition as possible. Clean nose, hydration, and then we're trying to help families understand what does a particularly ill child with bronchiolitis or pneumonia look like. Those kids are struggling to breathe even if their nose is clean and maybe their temp is down and they have as much fluid on board as they can. So we've been teaching families what it looks like. Their skin is pulling in under their ribs. It's pulling in at the neck. They look droopy and tired, like they are breathing so hard that they're getting pooped out. When no matter what the hospital bed status is, if a child looks like that, they need to come to the emergency room, and sometimes the 911 is going to be called. What we're really trying to do through these other mechanisms is help families recognize of which kids can stay at home with their good care. Again, only about 2% of even the less than 6-month-olds with RSV wind up in the hospital every year. Most kids with RSV, even less than 6 months of age, even with other health problems, can stay at home. So we're trying to help families get the information that they need to give the best care and recognize to stay out of the emergency room when it's safe. That the emergency department is actually the biggest volume problem right this minute. We're barely managing to keep up with beds using the creativity that Dr. Vines talked about.
Okay, great. And one other question, and before I cede my floor here, can you clarify, so for people who should consider not going to Thanksgiving gatherings tomorrow, are you specifically saying look at your family, children, if you have children less than 6 months or even 6 months to 3 years, or elderly relatives are immunocompromised, you should consider not going to the gathering, is that right?
And also anyone who's sick with a viral type illness. So people who have a stuffy nose, cough, that they could be at risk of spreading the virus. This would be a time that we'd want to, not sort of just buck it up and show up. This is the time when we'd want to say to each other, you know what, this is probably not the right time to show up with a stuffy nose. And for the host to give permission for people to do that.
And can you clarify, when you say elderly or older adults, who specifically are you talking about? Is there an age range?
To be, it's not like 65 and older typically. It's more over 70, over 80. Those significantly elderly people are much higher risk.
Okay, thank you.
You bet.
Thank you, Lillian. Next is Antonio, and we will be doing this question in Spanish.
Let me see. Okay. This is for Dr. Vines. Hi, Dr. Vines. In Spanish, if you can answer it. So are we telling families to modify their Thanksgiving gathering?
Buenas tardes, Antonio. En español, entonces.
Sí, por favor.
Sí, estamos pidiendo a las familias que cambien sus planes para la día feria mañana, que tengan menos gente en la casa y sobre todo si tengan niños pequeños y sobre todo bebés, infantes, que cambien sus planes para estar juntos y lejos de otras familias en este momento. O sea, que hagan otra cita para celebrar, porque este momento es tan grave que es mejor esperar.
Perfect. Just a follow-up question in English, but answering in Spanish. In general terms, do we know the demographics of kids being admitted? Are Latinos at a higher risk? In Spanish.
Sí, entonces cuando miramos quiénes son los niños que están en el hospital, vemos que sí hay más niños africanoamericanos y latinos en comparación con su porcentaje de la población. Entonces sí vemos una diferencia entre los niños en ese sentido.
Perfect. Thank you so much.
It wasn't on the VO.
Thank you, Antonio. And next up, we have KON.
Hello, Brenna Henthorn, Coin 6. Are we in a situation where when COVID got really bad, it was a situation of like schools having to offer hybrid options, keeping, young kids at home? Is this because it's 3 years and younger, not as big of a problem in schools, or is this a situation where you have to evaluate, like, maybe you should just keep your kid at home?
Yeah, thanks for that question. I want to be clear that we're not in sort of early COVID days with this message. We really want to reach families with young children, anyone else who may be high risk, and really everybody in the community who has a stake in seeing sick children get the specialty care they may need. So we are really trying to do a targeted approach, reaching families of young children. We're not doing broad brushstrokes, and we certainly learned the hard way that closing childcare, closing schools has so many other cascading health effects and emotional health effects on children. That is absolutely a last resort at this point. So thanks for that question.
And then one last question is, what does the recovery tail look like for RSV that doesn't end up having to go to the ER?
Yeah, RSV is kind of interesting because it has a little stereotypical pattern. It typically starts with a stuffy nose, maybe hardly recognizable, followed in 1 or 2 days by the onset of a cough. If you are very young or premature, that might be somewhat compressed, but kids usually start to cough more and breathe harder going into about the 5th day. So for the average young infant, they tend to peak in their illness about day 5, and then they may plateau there for a few days if they're relatively well and well enough to stay home, and then they tend to get better over 5 to 7 days, but they could cough for several weeks. We can generally predict that the virus is live and can be spread to other people for about 3 to 8 days. So that's why we just all have to really keep on top of hand washing, keeping our hands away from our face, cleaning surfaces, and if masks help, doing that. So I hope that answers your question about kind of a typical pattern.
Yes. Is the coughing something to worry about? Is it really when it gets to like that hard to breathe situation that it's really serious?
The cough is problematic when it seems like it's so persistent that they're struggling to catch their breath, and if it irritates their throat so much that it's hard to drink. So usually the cough in and of itself is more of a nuisance. But if they can sleep and drink and are not miserable, it just hurts our ears and it doesn't hurt the baby. But sometimes a little Tylenol will help, or other pain type relief. But acetaminophen or Tylenol is the #1 that we should be using in young babies. Yeah, so the cough by itself is not the problem.
Okay, thank you.
Now is it time for any last minute questions before we sign off? We also have a full file of today's recording. So if anybody needs access to that who was not able to record on their own computers, please contact us and we'll get you the recording. Again, you can email at ryan.yomber@multco.us or dial 503-729-1799 for any follow-up requests. Dr. Vines or Dr. Loeffler, anything else you want to leave any type of message with folks before we sign off?
Yeah, thanks. I'll just end where I should have started, which is, like with COVID, this is an evolving situation. So we're going to be watching hospital capacity really closely. We're going to be watching for any other prevention steps we want the public to know about or to take. So again, stay tuned to hear more about this, because the trajectory is for a very difficult, at least month ahead and probably more. So thanks again, everyone, for being here.
And I'll just chime in to say that we have reviewed some of the materials for parents that are out there. The Healthy Children's material that was generated by the American Academy of Pediatrics. They have nice pages on RSV and on bronchiolitis, including some videos. Johns Hopkins also has a nice document, if that'd be something that y'all be interested in linking to for your viewers.
Thank you. And with that, we are going to end it. Hope everyone has a safe holiday and appreciate everyone for coming today.